Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I'm here with my colleague, Commissioner Ken Lawrence, and today is Wednesday, December the 30th, 2020. We are in week 43 of the COVID pandemic here in Montgomery County. I want to welcome you to the last COVID-19 press briefing for 2020. This is the 96th briefing that we have held on this topic since our first briefing on March the 8th. I, for one, can't wait to say goodbye to 2020, and I look forward to a much happier, healthier, and hopefully within just a few months, a more normal 2021. Since our December 29th press release, we have 298 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 32,739. These positive cases are a result of a positive test for the virus, not from the antibody test. 22 of these are from long-term care facilities, 2 are from other congregate settings, and 274 are from our community. 269 of these tests are from the last 7 days or less. 27 tests are from 8 to 14 days ago, and 2 tests are from more than 14 days ago. These positive individuals are from 53 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 1-year-old to 96 years old. And you can, as always, check the county maps at montcopa.org/COVID-19 for updated geographic information. Today, we had 161 females and 137 males. I'm sorry to confirm that 5 additional Montgomery County residents have lost their life to COVID-19, which brings us to 1,007 deaths confirmed positive from COVID-19. This is an increase of 34 lives lost since last Wednesday. 3 of these individuals died in a hospital and 2 in a long-term care facility. They ranged in age from 53 years old to 94 years old. Overall, 521 females and 486 males have lost their lives to COVID-19 since the epidemic began here in Montgomery County. They have ranged in age from 34 years old to 104. Where we have self-reported racial identity, we have been reporting on that data. As of today, we have 2 individuals who are American Indian or Alaska Native, 26 Asian, 5 Asian Indian, 4 Asian Korean, 125 African American or Black, and 461 white, and 384 unknown. All inmates at the Montgomery County Correctional Facility that have tested positive for COVID-19 are in isolation and stable without symptoms. Our vaccine update. So lots of good news to report here. According to the Pennsylvania Department of Health, as of this week, 27,250 doses of vaccine have been delivered to Montgomery County hospitals. Under the auspices of the Federal Pharmacy Partnership, 6 Montgomery County long-term care facilities had CVS or Walgreens host a clinic to vaccinate residents and staff this week. The county itself has received 2,000 additional doses of vaccine this week, bringing our total to 4,000 doses. As planned, staff from our Office of Public Health, together with staff from our Department of Public Safety, began vaccinating paramedics and EMTs on Monday. And by the end of the day today, we will have vaccinated close to 700 individuals. And you can see some photos from what was a very happy event on Monday up on your screen now. There are many people that remain to be vaccinated in the Pennsylvania Department of Health 1A cohort. Beginning next Wednesday, January the 6th, the County Office of Public Health, together with the Department of Public Safety, will open a vaccine clinic for 1A category individuals only at the Montgomery County Community College Bluebell campus. Assuming we have adequate vaccine, the planned throughput is 1,000 people per day. Individuals in the 1A category include healthcare providers of all types, dentists, home healthcare workers, dialysis providers, personal care home workers, community group homes, and psychiatric hospitals. If you are a member of one of these groups and do not have access to vaccines through your workplace, or you do this work in an unpaid fashion, the county will be able to vaccinate you. Starting later today, please go to montcopa.org/COVID-19 and click on the green vaccine information button at the top of the page. This will take you to our vaccine information page. That link is currently live. Later today, on that page will be a link to a brief screening survey for 1A category individuals. The Office of Public Health will review the response to the survey and send a registration link to persons that fit into the above 1A category. So please be patient. I know there's an awful lot of people who want to be vaccinated as quickly as possible. And again, the rate limiting step here will be how much vaccine the county receives. But please fill out that survey, get into the line, and we will get to you as quickly as possible. Moving on to our positivity rate. Our positivity rate has ticked downward again this week. Our 14-day average positivity rate is 10.53% as of Friday, December the 25th, compared with 10.93% as of Friday, December the 18th. And you can see here our 14-day positivity graph. As a reminder, the orange jaggedy line is the number of tests conducted on any given day, and the blue line is the 14-day average positivity rate. As a reminder, a positivity rate below 5% is considered suppression of the virus. And this graph shows the daily positivity rates from December the 12th to December the 25th, showing that we're inching closer to 5%, but we are still above it on all 14 of those days. I just want to remark on that final line there on December the 25th, very few people were tested in the county, just a little over 300 that entire day. I'm presuming that most of the people who got tested that day got tested because they weren't feeling well. And we saw a very high positivity rate out of that group of people that were tested. So I wouldn't read too much into that one-day blip. As mentioned earlier, or as we have continued to have in the county, our hospitalizations remain high. They have improved slightly since last Wednesday. Today, we have 438 individuals with COVID-19 who are hospitalized in a Montgomery County hospital. This has decreased slightly from 464 last Wednesday. 13% or 60 of these individuals are requiring a ventilator. I had my weekly hospital call this morning with our hospitals, and several of them have had to go on divert at some point over these last days. They've had to do that for a variety of reasons, some because their intensive care units were full, others because their emergency departments were full and they didn't have room in the hospital to move their COVID patients out of the emergency rooms. So again, I just want to remind you, I know we're all very focused on the vaccine, but this pandemic has not in any way abated here in our county. And we have to continue doing what we've been doing to try to keep this thing under as much control as possible until we have enough vaccine for anyone in the community who wants to be vaccinated. For the 14-day period that ended on December the 25th, 54,295 Montgomery County residents were tested, which is a decrease of 5,664 people tested compared with the 14-day period that ended December the 18th. Again, this is a reflection of the Christmas holiday. The county had reduced hours over the holiday period, as did many other locations. So again, wouldn't read too much into this, and we'll have a much better sense of where we are in terms of the Christmas holiday at some point next week. So we'll move on to our date tested graph. As a reminder, the gray bars are the number of positive cases on that given day. The red is the total cases, both long-term care facility and community, with a 7-day average. The pink is the total cases with a 14-day average. The dark blue is the community 7-day average, and the light blue is the community 14-day average. And then way down at the bottom are our long-term care facility numbers. The orange is the 7-day average, and the yellow is the 14-day average. Actually, why don't we go ahead, Todd, and zoom in. You can see sort of what's been happening over the course of this fall. We've been in a definite surge period really since Halloween. That is a combination of the colder weather and people moving indoors, as well as a number of private social gatherings. You can see the uptick following Halloween. Then just as that started to level off, we had an uptick following the Thanksgiving holiday weekend, a pretty big one. And it's too soon to know if we'll see a comparable surge following the Christmas holiday. I do want to point out that while we're leveling off, our new baseline of approximately 330 cases per day places a significant burden on our first responders and hospitals. Will put pressure on our schools in terms of having enough staff to be able to offer in-person education. So as you make plans for this New Year's holiday, please consider the impact that Halloween and Thanksgiving holidays have had on our community. While we are all happy to say goodbye to 2020, please celebrate only with the people in your household. We continue to have good availability of testing. I want to urge anyone who needs or wants to be tested to get tested. Just want to remind you of our holiday schedule. Tomorrow, Thursday, December the 31st, all sites will be open from 9 to 2, so closing early at 2. On New Year's Day, Friday, January 1st, all testing sites will be closed. Saturday, January the 2nd, we will be open in Pottstown from 9 a.m. to 1 p.m., and the appointments for Pottstown will open online Friday evening at 7 p.m. The Pottstown location is at 364 King Street in Pottstown. And again, that'll be 9 to 1 on Saturday. And also, for those of you who are near the Ardmore site, on Monday, January the 4th, the Ardmore site will not open until 12:30 that day due to the need to re-site the testing office to a slightly different location at the site due to some significant water pooling at the site that we are now fondly calling Lake Ardmore. So we will be moving the testing box to a little bit better location on that site. As a reminder, if you know that you've been exposed to COVID-19, you should self-quarantine. If you would like to be tested, you need to wait until 5 days have passed since the exposure. Getting tested more quickly than that will not be reliable. If you test negative after 5 days, have not had any symptoms, and have not had ongoing exposure to someone with COVID-19, then your quarantine ends on the 8th day after exposure. To register for a test, our online registration is available for all sites at www.montgomery.org/COVID-19. Click on the green County Testing Information button, and appointments open at 7 a.m. on the day of testing, or when it comes to the Saturday testing at 7 p.m. the night before. If you would prefer to make an appointment by phone, phone registration is available for all the sites starting at 8:30 a.m. Monday through Friday, and will be open until slots are filled, and does offer language line for translation. There is no phone registration for the Saturday testing clinics. Just a reminder that we do remain in a serious and continually evolving situation. Together, we have the power to keep this virus in check while we await the arrival of enough vaccine in our community to vaccinate everyone who would like to be vaccinated. We're finally at the beginning of the end of this pandemic. While having vaccine allows us to fight this virus head on, we must continue to play defense for now. It will be a number of months before we have enough vaccine to vaccinate the general population. As a community, we remain in this together. The choices that each of us makes regarding our personal conduct, whether or not we wear a mask, attend private social gatherings over the holiday, or answer the phone when a contact tracer calls, impact all of us. Just one announcement today. I want to remind any restaurant owners that the Monco Strong 2021 Restaurant Grant Program began taking applications at noon today. Acknowledging the difficult situation our restaurants are in and the importance of this industry to the county, the Montgomery County Board of Commissioners has made available $5 million in county economic development funds to support restaurants and other food services businesses. Applications for the Monco Strong 2021 Restaurant Grant Program will close on Friday, January the 8th. These awards are not given on a first come, first served basis, so you have until the 8th to get your application in. Grants of $10,000 will be awarded to each qualifying business. Eligible applicants must be a for-profit restaurant, food truck, deli, bakery, brewery, distillery, vineyard, caterer, or other food services for-profit entity with a physical location in Montgomery County that has been in operation since at least January 1st, 2020, and has experienced disruption due to the COVID-19 global pandemic, and also meet several other criteria that are on the application. Please note that applicant entries that have been ordered closed for any public health violation by the Montgomery County Office of Public Health, including any issues related to the spread of COVID-19, or have willfully violated all lawful COVID-19 mitigation orders issued by the Commonwealth of Pennsylvania since January 1st, 2020, may not apply. Eligible grant expenses include rent or mortgage payments for a business location, payments for utilities for a business location, purchase of PPE, payroll for non-owner employees, and or their family members between the dates of January 1st and March 5th, 2021. This program is being jointly administered by the Montgomery County Commerce Department and the Redevelopment Authority of Montgomery County. We encourage restaurants and other food service businesses in need of support to look into this latest round of funding and apply. You should be able to get all your questions answered and submit any questions that aren't on the site or apply at www.montcopa.org/commerce. And I am pleased to tell you that as of 2 o'clock today, we had already received 140 applications. So we really look forward to being able to help these businesses during this very, very difficult time. Our next virtual briefing will be Wednesday, January the 6th, 2021. And with that, I'm happy to take questions.
We have no questions today, Commissioner.
Okay, well, that's easy. Then I wish everyone who's listening a very, very happy new year to you and your families. And we are all looking forward to a much brighter, happier, healthier 2021. Take care.